This video is a comprehensive older adult assessment for Aspen University in 495 Module 7, Professor Poindexter, recorded November 29th, 2020. The objectives of this video is a comprehensive assessment of a 70-year-old African American adult male. It will be the interpretation of abnormalities and coping. It will discuss reasons and causes, how the abnormality impacts life. It will discuss coping mechanisms, and it also will have a teaching plan. Okay, so we'll start with the general health history. The past medical history of this gentleman is he's a 70-year-old African American male. He has insulin-dependent diabetes mellitus, or IDDM, since 1994, a hypertension diagnosis since the year 2000, as well as hyperlipidemia. Past surgeries include coronary stents. In 1998, there were 2 stents there. Coronary artery bypass surgery in 2015. There were 4 vessels done at this time, but no valve replacement, and there were no complications, as this client reports that he was back to work in 2 months post-op, and also a vasectomy in 1986. Family medical history is both parents deceased. Father died of coronary artery disease in 1997 and was also 70 years old. Mother died of CVA in 2001 and she was 75 years old. And both parents had a history of diabetes and coronary artery disease. He has 4 siblings, 3 sisters and 1 brother, but only 1 living sister at current time. 1 sister died of a motor vehicle accident in 2014, and he did not know the medical history of his sister. 1 sister died of gallbladder cancer this year, and she was a diabetic. A brother died of a cocaine drug overdose, and he was also a diabetic. And the living sister has no diabetes, and he does not know any other health diagnosis. He also has no allergies to food or medication. Recorded physical information on this gentleman. Constitutional reports feeling overall good health with adequate energy and has a healthy appetite, denies fever, chills, night sweats, and pain. He reports his weight as 230 pounds. He's 5 foot 10 inches tall, which makes his BMI 33.3, which makes him obese because it should be less than 35. The skin has no sores, bruising, lesions, or moles, discolorations, or birthmarks. He does have a heel sternotomy incision from the cabbage that was done in 2015, but no skin discolorations, no pruritus, has a normal skin color, no tinting, nail beds are without discoloration or clubbing. His eyes are equally round and react to light and accommodation. He denies flashing lights and seeing rings around lights as one would see in glaucoma, which is sometimes a common ailment that befalls diabetics. He wears eyeglasses for both near and far-sighted deficits. His conjunctiva is white. His last eye doctor visit was August 2020. Head and neck, he was able to move his head in all directions without pain, with no nystagmus. Client has a bald head but has no injuries to his cranium. Ears, he denies pain or ringing in the ears. He has normal pinnas. Small amount of wax was noticed in his ear, but both eardrums were visualized. He denied any difficulty hearing and no swelling in the lymph node region. Physical continued. His mouth and throat, he had most of his teeth. The teeth were white. His tongue was pink with no white covering. Gums were also pink. He has his tonsils. There is no redness or swelling noted, and he visits his dentist twice a year. The nose had no spider angioma and no nasal deviation, no sinus drainage or epistaxis. Respiratory, his bilateral breath sounds were clear to auscultation. There was no wheezing, cough, sputum, or hemoptysis. He denies shortness of breath. He does have report shortness of breath with strenuous activity at times, which is relieved with rest. He denied any chest pain, and he does not use home oxygen. Cardiovascular, There was S1, S2, no heart murmurs, denied palpitations, reports feeling heart pounding with strenuous activity. And this activity was also accompanied with shortness of breath that he also said was alleviated with rest. He had slight edema noted to bilateral feet and ankles, which was I noted as a 1 plus edema. No sores or lesion to feet and toes, and is diligent about keeping his feet clean and dry and examining his feet daily for any type of injury that he states is aware that can happen with diabetics, and this can be disastrous for them. He states he wears cotton socks and the appropriate size footwear that do not rub on his feet. Medications currently taken by the client is two types of insulin. One is Aspart, which is a fast-acting insulin taken with usually after meals. He says he takes it 4 or 5 times a day, and whatever his reading is, he usually takes these units according to the reading level. He also takes Lantus 40 units daily at night. He's also on by mouth medications, Lasix 20 milligrams daily, Pravastatin 1 tablet at night, Ramipril 2.5 milligrams daily, Metoprolol 50 milligrams daily, Januvia 100 milligrams daily, and Norvasc 5 milligrams daily. Also, it's a good idea to assess a patient's health maintenance and how well they take care of themselves and what they actually do as activities and the like. This client is a die maker. He currently still works. He has 45 years working as skilled trades for General Motors, and he does state that he is in contact environmentally with fine metal shavings, but that General Motors provide the appropriate sort of a protective covering, such as gloves, safety goggles, helmets, and arm coverings, and he also wears coveralls at work, so he is not in contact with that. He does bowl 1 time a week for 2 hours, about 3 hours, he says. And he says he gets 6 to 8 hours of sleep a night and admits feeling rested when he wakes up. He has received all of his usual childhood immunizations and had a tetanus booster within the last 7 years, he thinks. He did state that he received his flu and pneumonia vaccine last month. He visits his cardiologist yearly, which he had a visit this year, and his last visit with his medical provider was about 6 weeks ago. He had a colonoscopy last year, which was negative, and he did admit that he does not adhere to the usual diabetic diet, and his glucometer readings are between 250 or 300 and sometimes more, he said, and his hemoglobin A1C level was greater than 9. So we know that we need to do some work there. Okay, so after reviewing the information we have obtained so far with our comprehensive assessment and the physical assessment and medications, the interpretations and findings are, of course, uncontrolled diabetes because his readings are greater than 250 and sometimes 300 consistently. He also is obese because his ideal body weight should be somewhere between 149 to 183 pounds, and he is actually 230 pounds. So there needs to be some work done there to lose some weight. He reports very little exercise outside of his bowling and work, and he does not adhere to the diabetic diet. So there's some work to be done here that could perhaps decrease his risk for negative outcomes. So when we're looking at a comprehensive assessment on an individual, it's important to know why the person has abnormal readings and abnormal information and what impact it causes on their life. This person has uncontrolled diabetes, and one of the causes we know, as we went over his family history, is that he has a genetic predisposition because both his parents had diabetes and his sisters had it, and also brother. So he has a very high genetic predisposition towards having diabetes and coronary artery disease and hypertension. So all these things make it difficult for this gentleman. He also admits frustration over food choices and multiple finger sticks he has to do every day and injections of the insulin. He states it's very frustrating for him having that diabetes, and it's just sometimes he gives up and he just eats whatever he wants because he says it's his lack of knowledge about how to prepare a proper diet. And since he's a single guy, he's been divorced for a few years, but he doesn't um, really know how to make his food right and know what foods to cook. So he eats fast foods a lot, and that's causing his blood sugars to stream up high. So those are one of the things that's educationally he will need to be educated on proper food choices and how to prepare a diet for himself, and also lack of exercise. So reviewing some things that he can do immediately to help decrease his blood sugar readings, which will also decrease his weight. Another important area to review on the elderly is the psychological goal and teaching strategies. And we do this through Eric Erickson's 8 stages of psychological development. The very last stage we know is called ego integrity versus despair. And this stage begins at age 65 and ends at death. It is at this time we contemplate the accomplishments that can develop integrity if we see ourselves as leading a very successful life. Emotionally, we struggle with the loss of loved ones, our careers, and our independence. Physically, our bodies are not as vibrant as they were when we were younger, and you look back on life with a sense of closure and completeness, and can also accept death without fear. So these were some things that was talked about because this gentleman had lost both his parents, 2 sisters, and a brother. So, and although he states he feels sad about that, he does not let that determine his life as far as being depressed and not wanting to go on with his life. He denied any suicidal ideation, and he has a very comfortable sense of himself in the world and feels like he's done a lot with his family, as he's very family oriented. So he is very comfortable with how his life has gone, and he has no regrets. So some strategies here is to acknowledge that the changes occurred within us as we age, which he knows he has. He has done that. When you are aware of those changes, then they will not surprise you. Eat with friends, family, or a neighbor. This is other things that you can do if you do not have a significant other. And stay active so you can be around other people, which can help lift you up. So the social history that a person has a lot to do with their psychological well-being as well. And as this gentleman was interviewed, he stated that he's been divorced 5 years ago. He lives alone with in a two-story home. He does have a significant other. He's had a girlfriend for 3 years and states that they have a very healthy sex life. He's been employed with General Motors for 45 years, which he's happy about. He doesn't feel overworked, he says. He works there as a skilled tradesman, so his work is not stressful. He denied ever smoking tobacco and substance use or alcohol because he said his parents had a history of alcoholism, and he just, as a child, saw that and did never want to drink, which is good for him. He denies having, like I said before, he denied having regrets about aging. He goes to church every Sunday with his girlfriend, and he's also an active member of an African American motorcycle club that he travels with. He has a motorcycle that he rides, and they travel frequently from state to state during the year on various events. So he says he has a very active life. He's very happy with the way things are going, and socially he is very healthy. So some cultural aspects and teaching strategies when assessing and doing a comprehensive assessment is what it says here. We don't learn from talking, but we learn from listening. So active listening is extremely important because many things can be learned through the interview process and the assessment by listening and to the patient, and sometimes listening even with your third ear, and watching the body language on patients too as they're talking, making good eye contact and building that trust and rapport. And it's important not to make assumptions about individuals, but to let them explain themselves and not jump to conclusion. And that's the best way that we can educate patients about medical practices. So, some developmental goals and strategies that have been put in place by the AARP um, ensures that sustainable development goals, which are called SDGs, are met for all the segments of society, but most importantly, this includes the vulnerable adults and the older persons, as protecting and promoting the rights of the older persons. Also, ending poverty in old age. This seems to be a very common theme, that as we age and cannot and be any longer working, that our income reduces and there's not enough funds with Social Security and the like to help the elderly individuals who may not ask for help. That's just not in their makeup. They don't like to ask for help. So we have to be aware that that's an issue. So ending poverty in old age is certainly a goal that they want to have by 2030. This is one of the things on the agenda for the SDGs. Also of interest there is strengthen the ability of older persons to maintain an adequate standard of living. Because this, as we age and can't have the money coming in anymore, decreased retirement income causes the living situation to be decreased. And this will affect a patient's health because they won't ask for help, and then their health will deteriorate, and sometimes they don't access care until their symptoms are very severe and making them have bad outcomes because they don't recover as well. So it's important that they maintain an adequate standard of living. Also, adequate and affordable independent housing for the elderly, and we need to end age-based discrimination. Many elderly people, as they get 65 and older, are still viable in the workplace and can still work, but sometimes employers prefer younger individuals. And so we're looking to end that age-based discrimination. Spiritual goals are also things that the elderly people, as we get older, we tend to think more about, our spirituality. And that's why I included this message here. Religion is following the messenger, and spirituality is following the message. So actively taking part in church services can be very rewarding and for all ages, but especially when we become older. Keeping a spiritual journal that we can write in and reflect our innermost thoughts. Practice forgiveness, maybe for things that we think happened that were wrong, family members treated us wrong, or friends, and practicing that forgiveness and being able to talk that out. And that can also be included in your spiritual journal. Converse with God daily. If this is something that is important to some individuals, read encouraging books from religious or spiritual bookstores, or certainly online. They have different things that we can read that are very encouraging, and practicing daily prayer. And certainly this is all optional. There may be some elderly people that don't believe in this kind of a thing, but certainly this gentleman that I spoke with, he goes to church every Sunday with his girlfriend, and these were some of the things that he's liked. He does actively take part in church services, but he thought the part about keeping a spiritual journal and encouraging books was a very good idea. And he already said he practices daily prayer and has forgiven a lot in his life. So these are some things that can help the elderly with their ego integrity versus despair.